Good evening, ladies and gentlemen.
Good evening.
My name is Gertrude Nwoke. I'm a student at University of Texas in Arlington. I'm working on my master's degree in nursing, specializing in nurse practitioner program. One of the classes I'm taking is nursing management in healthcare environment. I have an assignment to do a PowerPoint presentation on the leadership theories. The theory that I picked, that I worked on, is charismatic leadership. And that's what I'm going to give you a 10 minutes presentation. It's going to be only 10 minutes. And after that, you have 5 minutes to ask your questions. Okay. I will go ahead and hand you all over the copies of my presentation, PowerPoint presentation, and also the evaluation form, so you can evaluate and assess what I did present to you all. And after that, I will have you all introduce yourselves.
Okay.
One last thing, I want to express my gratitude to you all for making out time to come in to listen to my presentation. Thank you so much, and I appreciate that.
You're welcome.
Here we go. This is the evaluation, and that's the copy. You can write down the questions you want to ask. Okay, could you all please introduce yourself, starting with you on the left side?
Hi, I'm Sandra Wapike.
Thank you.
Hi, I'm Priscilla Counter, and I'll be the proctor today.
Thank you so much.
You're welcome.
I'm Joel.
Thank you.
Yes, my name is Mark Anthony.
Thank you so much. Now, we'll go ahead and start the presentation. Like I said earlier, I'm going to be presenting on charismatic leadership. I will start with overview of the theory of charismatic leadership. The Evolution of Charismatic Leadership was written by J.A. Conger. He was a theorist as well as a writer. He is the one that proposed the model, how charisma evolved. On the model he proposed, he has about 4 stages of the model. The first one is constant assessment of environment by a charismatic leader. They are always in constant assessment of the environment because they're moving with every change and trying to accomplish something with that change. The second one is establishment of goals with vision. They always have vision of goal and work with their followers to achieve that goal. Coordination to followers, commitment and trust. They are always committed to the goal they want to achieve. And again, motivation. There are also some behavioral dimensions which they use their natural gift as a charismatic leader to work with. They have a very ideological visions. They are very inspiratory in nature. And they act with the spirit of heroism. They act like heroes. The theory overview continues. Obviously, in this theory, there are no empirical studies or tools used or data used for this theory. But certain empirical studies on behaviors and attributes were identified, such as ability to articulate. They are always articulative in nature. Domineering, influential, they are very influential leaders. And then followers, attention, they're always getting attention of their followers. Also validity and reliability. There was no identified validity and reliability in the study. because it is kind of like very ambiguous knowledge of the charismatic theory. And also the theories, there was no acceptable behavior and attributes by researchers with this theory. Theory strengths. The strengths of the theory. One of the greatest leaders, a charismatic leader we know, is Ronald Reagan. He used a very exceptional behavior and expertise in displaying the qualities of a charismatic leader, which are visionary attributes, inspirational concept, trust, personal risk-taking, sensitivity to members' need, leader impression management, and communication skill. They communicate effectively. Empowerment. They always empower their subordinates. Their ethical values they have is integrity, role model, honesty, and passion. The weakness of the theory. Negative characteristics of this theory. Charismatic leaders, they have both negative and positive characteristics. But when their negative characteristics, some of them are like personalized power orientation. They do not like sharing their power with their subordinates. They are very demanding in personalities. And with that demanding personality, they always will end up in achieving negative control. Tragic goals too. Normally a charismatic leader does not accept status quo, but as weakness on the side, they can accept that, and which is not one of the qualities of a good charismatic leader. They also have emotional attachment to leadership. Effects of that emotional attachment to leadership can lead to fear in followers and lack of power sharing. Perspective of the theory, charismatic leadership. My perspective about charismatic leadership is that their ideological visions promotes change in organization. It also encourages growth and development, as well as motivation of their followers. The usefulness of these theories, charismatic leaders, their skill, they use it in promoting organizational skill. They are role models, and they use that to inspire employees in good achievement. Good communication skill. They also use it in promoting organizational skills. Recommendations. Charismatic leadership skill empowers, inspires, motivates, and to employees in order to foster growth and development of an organization. Also, with shared decision-making involving charismatic leadership, the employees contribute values in the organization, and they are also loyal and trust the organization because they feel that their contribution is being valued. That's the end of the presentation. I'm gonna give you 5 minutes to ask questions about the charismatic leadership, about the presentation, PowerPoint presentation. Yes.
How does this theory benefit nursing management?
The theory benefits nursing practice in general because one of the qualities of charismatic leadership is communication skill. They have a very effective communication skill. When a nurse leader communicates very well, it promotes retention and it promotes recruitment. It promotes a positive work environment. The employees have trust and confidence in the nurse leader as well as the organization, and it improves outcome and quality health care.
Okay, thank you.
Any other question?
I was raising my hand earlier, but that's the same kind of question I was trying to.
Okay.
Can a charismatic leader improve health care of the patient?
Yes. It will. The charismatic leader will improve health care of a patient because if the employees work cooperatively, work as a team, and also with being a role model to them, and also mentorship program. Everybody pulls together and work as a team to promote optimal health. Team. Any other question?
Yes.
1 second. What are the other leadership theories?
Okay. There are several leadership theories. The other leadership theories are situational theory, transformational theory, transactional theory, goal pathway theories. There are several of them. And the most important thing is it helps the leaders. All these theories helps the leaders to identify their strengths and weaknesses, and which is what promotes outcome of the organization.
Thank you.
Thank you. Any other question? Did everybody understand the charismatic leadership on the PowerPoint slide?
Exactly.
Yes.
We did.
Thank you so very much. You can fill your evaluation forms. And thank you so much for coming.
You're welcome.
Okay.